Namaste. Greetings on Doctor's Day. It is a pleasure for me to be participating in this special event being organized by the Strategic Institute for Public Health Education and Research, SIFA. The theme of Doctor's Day this year is particularly important because it calls on all doctors to try and reduce the deaths due to COVID-19. Even as many parts of the country are now waging a battle against the virus, it is somewhat heartening for us to know that the death rates due to COVID in terms of deaths per million are relatively low in India. However, since the virus has not touched many individuals in this country, particularly in smaller towns and cities and in rural areas, we have to now take many measures to protect the virus from spreading. At the same time, we have to try and save the lives of those who have been infected by the virus. It is important that the doctors who are playing such a selfless role in providing services to the people who need, irrespective of any concern for their own personal safety, should be saluted and thanked on this particular day. However, as doctors, we also have an additional duty. We have to ensure that we build a very strong health system which is functioning well in the steady state so that it can actually build surge capacity very well during a public health emergency. Unfortunately, we have not invested adequately in building that kind of health system across the country. What we need to do is to invest more of our public financing and ensure that we have universal health coverage which can be delivered through an efficient and empathetic healthcare delivery system. Otherwise, doctors themselves, however noble and hardworking they are, will be functioning against the inefficiencies of a weak health system. So, while we must now do our very best to try and save lives, we must also try and advocate for universal health coverage based on an efficient and empathetic healthcare system. We also recognize that many of the deaths in this particular epidemic of COVID-19 are occurring in people with comorbidities, people who have coronary heart disease, respiratory disease, or cardiovascular disease and hypertension together, or even who are on cancer chemotherapy. Many of them have been smokers and tobacco consumers. So we have to also advocate for programs which will actually reduce non-communicable diseases and other comorbidities and bring strict controls on noxious agents like tobacco, which increase the risk of disease as well as the risk of death from COVID. So we have a role both as caregivers as well as advocates for health promoting policies. And on Doctor's Day, we must recognize that we have this role to guide patients not only to better health, but also to guide the society in India to a healthier status. I wish you all the best and thank you very much again.